Hello guys, welcome back to my YouTube channel. Today I am going to discuss about the optic nerve and the visual pathway. From this video you will learn about the optic nerve, the various relations and pathway of the optic nerve, the relation of the field of vision to the retinal quadrants and optic chiasma, optic tract, lateral geniculate body, optic radiation, and then visual cortex, and finally the pupillary light reflex, accommodation reflex, and corneal reflex, and finally, clinical correlations. So, stay with us to learn about the optic nerve and visual pathway. The optic nerve or the visual pathway conveys visual impulses from the retina to the visual cortex in occipital lobe of the cerebrum. The visual impulses are generated in the rods and cone cells of the retina. Here I have drawn a picture with cone cells and you can see the rods. Then these photoreceptor cells act as transducers which converting light signals into electrical signals. These signals are preceded in the bipolar cells. Those bipolar cells are the first order neurons, and then in the ganglion cells. The ganglion cells are the second order neurons. Then the axons of the ganglion cells collect to form the optic nerve. The optic nerve unite to form optic chiasma. Here, the optic nerve united and forms the where the decussation of nasal fibers takes place, then the optic tract begins from the optic chiasma. It terminates on lateral geniculate body, and the neurons of the lateral geniculate body are the third order neurons. Then they give origin to optic radiation, which terminates on the visual cortex. So now I'm going into detail about the pathway. From this picture you can see the inner aspect of the eye. Here you can see the retina, here the optic disc where the optic nerve opens. So here the optic nerve, you can see the yellow part is the optic nerve. Optic nerve emerge from the retina at the optic disc, and it is composed of axons of ganglion cells of the retina. It is about 4 centimeters in length and being an extension of central nervous system of axons of optic nerve are myelinated by oligodendroglia, and hence the optic nerve is unable to regenerate on injury. So there are coverings of the optic nerve because they are developmentally the optic nerve is the extension of diencephalon and it is covered with 3 meninges like in the brain. This is the optic nerve. I will show you the 3 meninges around the optic nerve. Here you can see the ganglion cell with axons. These are the ganglion cells with axons, and this is the direction of axoplasmic flow. So this is the optic nerve. You can see externally, this is the dura mater, then you have the arachnoid mater, and you have CSF in subarachnoid space, then you have the pia mater as in the brain. This is the central retinal artery and vein. This subarachnoid matter, the subarachnoid space extends around the optic nerve inside the orbit as well. Therefore, increase in intracranial pressure slows the venous return from the central vein of the retina, causing papilloedema. You have to remember this clinical aspect. Because of this subarachnoid space extends around the optic nerve inside the orbit. If there is increased intracranial pressure, what happens is this venous drainage become blocked. There is backflow of blood from the central vein of the retina. So it can cause papilloedema. I'll show you a picture of papilloedema, how you can see from a fundoscope or from an ophthalmoscope. This is how the papilloedema looks like. You should be able to diagnose clinically through a fundoscope or an ophthalmoscope. This is a normal optic disc area. You can see various blood vessels, and here the optic nerve opens. Here the area where optic nerve opens. You can see the blood vessels are normal, and here you can see the blood vessels are somewhat dilated, or there is venous engorgement here. So this is called as papilloedema. Next, I will discuss about the parts of the optic nerve. Optic nerve can be subdivided into intraorbital, then canalicular, intracanalicular, and intracranial parts. In the intraorbital part, it is surrounded by ocular muscles. The central artery enters the substance of optic nerve on its inferomedial aspect behind the eyeball. The optic nerve crossed superiorly by three structures. Here you can see the intraorbital part. So it is crossed by three structures. Nasociliary nerve. I'll show you the nasociliary nerve. Here is the nasociliary nerve. And then ophthalmic artery. You cannot see ophthalmic artery here. Then superior ophthalmic vein from lateral to medial side. Along with this nasociliary nerve, ophthalmic artery and superior ophthalmic vein crosses the optic nerve from lateral to medial side. Remember that as well. This is important in spots. Here is the canalicular part or the intracanalicular part. It is passing through the optic canal, and it is about half of the centimeter in length. Here it is very closely related to ophthalmic artery. This area is the intracranial part of the optic nerve. It is related to the gyrus rectus of the inferior surface of the frontal lobe, optic tract, and anterior cerebral artery. I'll show you the relations of the intracranial part from this diagram. This area is the intracranial part up to the formation of optic chiasma. So, in this area, the above relations or the superior relations are the gyrus rectus and the olfactory tract. These are the olfactory tract, and there is anterior cerebral artery. Below this intracranial part of the optic nerve have tuberculum sellae and diaphragma sellae. From this picture you can see in the intracranial part how the ophthalmic artery enters in the branches of the ophthalmic artery enters into the optic nerve. Actually those branches are entering this branch is entering from the inferomedial aspect, central retinal artery. You can see very well. This side is the lateral side and this is the medial side. This is the internal carotid artery, and branch of internal carotid artery you have ophthalmic artery. Then this central retinal artery is a branch of ophthalmic artery. Then you can see here the ophthalmic artery crossing from the lateral to medial side along with the nasociliary nerve. There should be superior ophthalmic vein also in here. It crosses also lateral to medial above the optic nerve. I hope you are clear with the three parts of the optic nerve. Then blood supply to the optic nerve. The central artery of retina supplies the intraorbital part. Then the bundles of ophthalmic artery supplies canalicular part. Then superior hypophyseal artery supplies intracranial part of the optic nerve. Then I will talk about the relation of field of vision to the retinal quadrants. Here, this area is the nasal retina, and this area is the temporal retina. This area is the visual field, the temporal visual field, and this area is the nasal visual field. This area, temporal visual field. Then this area, nasal visual field. This is for this eye. Here you can see temporal hemiretina. This part is the temporal hemiretina. They receive image input from the nasal visual field. From this area, they receive image input from the nasal visual field. Temporal retina receive image input from the fibers or the field of vision from the nasal visual field. Then this part is the nasal hemiretina. Nasal hemiretina. This nasal hemiretina receive the visual input, visual image input from temporal visual field. This is the temporal visual field for this eye. This is the nasal visual field for this eye. This part is the nasal visual field for this eye. So you can see the temporal retina, don't mix up with these words. This is temporal retina and this is temporal visual field. This temporal retina receives nasal visual field input, and then this nasal retina receives visual inputs from the temporal visual field. You have to understand this concept very clearly, otherwise you cannot work out what happens if the optic nerve damage in various situations. Imagine this is the retina, then upper retinal quadrants. Upper retinal quadrants means this area. This upper retinal quadrants receive images from the lower visual field. Then this is the lower retinal quadrants. So this lower retinal quadrants receive image from the upper visual field. You have to remember that as well. Next, I am going to discuss about the optic chiasma a little bit. The optic chiasma is a midline structure in the middle cranial fossa. This area is the optic chiasma. It is formed by the fibers of the right and left optic nerves. You can see this is the right optic nerve and this is the left optic nerve. So, this optic chiasma is made up of right and left optic nerves. The nasal or the medial fibers, these are the nasal or the medial fibers, they are decussate in the central part of the chiasma. Then the temporal or the lateral fibers do not decussate in the chiasma. Macular fibers cross in the posterior inferior margin of the chiasma. Remember that. Here I will show you what are the relations of the optic chiasma. Superiorly, optic chiasma is related to the flow of the third ventricle. Laterally, it is related to the bifurcation of the internal carotid artery. This is the internal carotid artery. So, laterally, it is related to the bifurcation of the internal carotid artery and anterior perforated substance. Anteriorly, The lamina terminalis extends from the optic chiasma to the paraterminal gyrus. Then, anterior communicating artery is also an anterior relation of optic chiasma. Here, one of the most important structure, the infundibulum and the pituitary gland. So, it is a relation of postero-inferiorly to the optic chiasma. When we talk about the arterial supply to the optic chiasma, it receives ample supply of branches from anterior cerebral, internal carotid, posterior communicating and middle cerebral arteries. Then the optic tract. It begins at the posterolateral end of the optic chiasma. This is the optic tract. It is composed of ipsilateral temporal fibers and contralateral nasal fibers. Here imagine this is the optic tract in right side. This contains ipsilateral temporal fibers. Ipsilateral temporal fibers and contralateral nasal fibers. Each optic tract courses backwards along the anterolateral boundary of the interpeduncular fossa and crosses the cerebral peduncle. Majority of these fibers ends in the lateral geniculate body. This is the lateral geniculate body, and few in the superior colliculus via superior brachium. Then the lateral geniculate body. This is a thalamic relay station for visual impulses. This is the lateral geniculate body. It receives fibers from ipsilateral temporal retina, and contralateral nasal retina. The lateral geniculate body contains third order neurons in the visual pathway. Here, don't mix up with the visual fields. These fibers are coming from the temporal retina. These are the temporal retinal fibers, but the visual field is the nasal visual field. Here, this is the nasal visual field. This is the temporal visual field. Again, this is the nasal visual field. This is the temporal visual field. So the fibers here, these fibers are coming from the temporal retina. But the visual field is nasal visual field. Don't mix up with the terms. Here, imagine this is a lateral geniculate body and this is the eyeball. So this area is the retina. The medial part of the lateral geniculate body, this part, medial part of the lateral geniculate body receive fibers from the upper half of the retina. And then its lateral part, here this is the lateral part of the lateral geniculate body, receive fibers from the lower half of the retina. The peripheral part of the retina is represented in its anterior part, while macular fibers terminates in the large central and posterior area. Actually, this lateral geniculate body is a 3D structure. I cannot show that 3D structure here. So remember how the fibers are coming to the lateral geniculate body. Then the optic radiation. This is the optic radiation. It extends from the lateral geniculate body to the visual cortex. To reach the visual cortex, it passes through retinolentiform part of the internal capsule as well. Upper fibers of the optic radiation sweeps directly backwards and end in the cuneus in the upper lip of calcarine sulcus. And these fibers carry impulses from the superior retinal quadrants representing inferior visual field. Again, here this is the eyeball and here this is the visual cortex. So the fibers from the superior retinal quadrants. This area is the superior retinal quadrants. So the fibers from the superior retinal quadrants represents inferior visual field. That means if I draw a person or man like this superior retinal fibers means the visual field is lower visual field or the inferior visual field. Lower retinal fibers means the upper visual field. Then the lower fibers of the optic radiation form a loop by first turning anteriorly to the temporal lobe. This loop is in close relation with the inferior horn of the lateral ventricle. Then after these fibers turn posteriorly to communicate with the cuneus in the lower lip of calcarine sulcus. These fibers carry impulses from the inferior retinal quadrants representing superior visual fields. That means lower optic radiation. Imagine this is the lower optic radiation. This is the lower optic radiation. So this carry lower retinal fibers representing superior visual field. Nothing much to remember. Lower optic radiation, lower fibers of the optic radiation carry impulses from inferior retinal quadrants. That means it represents the superior visual field. Then the upper optic radiation, upper fibers of the optic radiation means the fibers coming from the upper retinal quadrants. So the upper retinal quadrants means inferior visual field. That is inferior visual field. Hope you are clear with these terms. Then the visual cortex, it is also known as striate cortex. Area 17. Area includes cuneus and lingual gyri and the calcarine sulcus. Visual cortex receive impulses from the retinal halves of the same side, opposite half of field of vision. That means here, this is the retina, this is the right side or the nasal retina, and this is also the right side of the retina, but it is the temporal retina. This is also the right side of the retina. This is also the right side of the retina, but the names are different. Actually, this is the nasal retina and this is the temporal retina. You can see these areas getting fibers from this part. That means this visual field. That means the visual field is in the left side. Right retina, here the right side of the retina. In the left eye also right side of the retina, right eye also the right side of the retina I'm talking about. You can see the visual impulses are coming from this left visual field, whole left visual field. But the names are changed or names are different. This is the nasal retina and this is the temporal retina. Don't mix up with those names. Here you have to remember this part is the right retina and right retina of the right eye, and this is the right retina of the left eye. Both of these right side of the retina in both eyes get visual field from the left side. I want to emphasize that part only. So the visual cortex here, you can see the red fibers are coming here, coming from right side or the nasal retina. Here the red fibers are coming from the same right side or from the temporal retina. Both these red fibers, that means from the right side, right retina of the left eye and the right retina of the right eye, getting impulse the visual field of the left visual field. Those fibers going to the retinal half of the same side. Here, those fibers go into the visual cortex of the same side. From the right side of the retina of the left eye and right side of the retina from the right side get fibers to the right visual cortex. But the visual field is the left visual field. Hope you are clear with these terms. The right visual cortex, C, left visual field. But the retinal fibers are the retinal fibers coming from the right side of the left eye as well as the right side of the right eye. Then here also the same. This part is the left side of the left eye. This part is the left retinal fibers of the right eye. But you can see these fibers are coming from the right visual field. This is the right visual field. Hope you understand. Now, see blue fibers from the left retina of the right eye, and here the blue fibers from the left retina of the left eye. Those fibers coming to the left visual cortex. But this left visual cortex, see the right visual field. This right visual field. Same as that, upper quadrants of the retina projected to the upper lip of the calcarine sulcus, and the lower quadrants of the retina projects towards the lower lip of the calcarine sulcus, and macula represents in the occipital pole. Then I'm going to discuss about the visual reflexes, the pupillary light reflex and the accommodation reflex and corneal reflex separately. Before that, I'm going to discuss what are the clinical correlations of this pathway, this optic visual pathway. What happens if the optic nerve damage in particular areas, the optic nerve as well as optic chiasma, optic radiation damage at particular areas, what happens to our visual fields? I'm going to talk about that first before the reflexes. Imagine if there is a lesion. Here the first lesion is in the optic nerve. When there is a lesion, you can see here is the lesion, first one. If there is a lesion in the optic nerve, there may be ipsilateral total blindness, that means anopia. Here the optic nerve, right-sided optic nerve has been damaged. So you cannot see the ipsilateral visual field. That means right-sided visual field you cannot see. That is called as anopia. Then the lesion in the optic chiasma. The lesions in the optic chiasma can be divided into two as what happens in the central part and what happens in the lateral part if the lesion occurs. In the central portion of the chiasma, it can be compressed due to expanding pituitary tumor. So, it can result in bitemporal hemianopia. See, the fibers coming to this area, this blue color fibers coming from the nasal visual field of the right eye, and this red color fibers coming from the nasal visual field of the left eye. But you can see this right side nasal retina receives fibers from the temporal visual field, right side temporal visual field. This left-sided nasal retina receives fibers from the left-sided temporal visual field. Now you can understand what happens if the damage occurs in the center of the optic chiasma. You cannot see both temporal areas, both temporal visual fields. That's why we call it as bitemporal hemianopia. Now, the third lesion is in the lateral part of the optic chiasma. If the optic chiasma is compressed at its lateral angle on one side, only it causes ipsilateral nasal hemianopia. But there can be binasal hemianopia if bilateral lesion of the lateral angles of the optic chiasma occurs. As an example, this bilateral lesion can be occur in bilateral internal carotid artery calcification. So here, this blue fibers coming from the temporal area of the left eye. The temporal area of the left eye receives fibers from the nasal visual field. Here, the red fibers coming from the temporal retina of the right eye. So the temporal retina of the right eye receives the fibers from the nasal visual field. So what happens in bilateral lesion? There can be loss of vision in the nasal visual field in both visual fields. That is why we call it as binasal hemianopia. You cannot see the nasal visual field in both sides. Then the next lesion is what happens if the lesion in the optic tract. Imagine the lesion in the right-sided optic tract, the fourth type of lesion. Then what happens is here the red color fibers, here see only red color fibers. This red color fibers in this side coming from the right-sided temporal retina. That means the nasal visual field. Then here red fibers coming from the left-sided nasal retina. Left-sided nasal retina. Here right-sided temporal retina. But the visual field you can see these fibers and these fibers coming from this side and this side. That means lateral. Not lateral, that means left-sided. Here is the left-sided temporal visual field and here is the left-sided nasal visual field. So, you can see if the damage occur in the right-sided optic tract, there can be left-sided homonymous hemianopia. That means we cannot see the left-sided visual field in both eyes. In the left eye also we cannot see the left-sided visual field. In the right eye also we cannot see the left-sided visual field. That's why we call it as left homonymous hemianopia. Now the next type of lesion, imagine it is in the lateral geniculate body or the optic radiation. So if the lesion is in the lateral geniculate body in the right side or the optic radiation in the right side, in the fifth one here. So you will get the left-sided homonymous hemianopia. Here I have mentioned the quadrants separately here, but these quadrants actually the homonymous hemianopia occur in these quadrants according to the fibers damaged in the optic radiation. You will have to remember only that there may be left-sided homonymous hemianopia if the right-sided lateral geniculate body or right-sided optic radiation get damaged. There is another lesion called macular sparing lesion. In the retina, imagine this is retina, there is an area called macula, and in the middle of the macula there is more fine area called fovea. This is fovea. This is macula. Here, this macula is supplied by both posterior cerebral artery and middle cerebral artery. So remember that if the lesion is occur in the right-sided visual cortex, that means the blood supply from the posterior cerebral artery to the right-sided visual cortex is cut off due to an occlusion. Then there may be contralateral homonymous hemianopia with sparing of macular vision. So you can see how the visual field look like if there is occlusion of the posterior cerebral artery which supplies to one side. Then there is contralateral homonymous hemianopia with sparing of macular vision. So now you can understand or work out what happens if there is any lesion occur in the visual pathway and what are the visual fields that are gone. Now I am going to discuss about the visual reflexes. The first I will going to discuss about the pupillary light reflex or direct and consensual light reflex. That means when light is directed to one eye, both pupils are constricted, and the constriction of the pupil in the light directed eye causes direct light reflex, and the constriction of pupil in the other eye causes consensual light reflex. So imagine the light source comes here. So the constriction of this eye, we call this as direct light reflex, and the constriction of the pupil in this eye, we call this as consensual light reflex. So from the light source, impulses coming like this, and here you can see the pathway, then through the optic nerve and the optic chiasma, then optic tract, and some fibers goes towards the pretectal nucleus in the midbrain. From the pretectal nucleus, you can see the fibers given to the Meninges nucleus of the motor of the oculomotor nerve in both sides. You can see from one pretectal nucleus, the fibers going to the both Meninges nucleus of oculomotor nerve. So from the Meninges nucleus of the oculomotor nerve, the preganglionic parasympathetic fibers, these are the preganglionic parasympathetic fibers which are going towards the ciliary ganglion of both sides. From the ciliary ganglion, there are short ciliary nerves arises, and those short ciliary nerves supplies constrictor pupillae muscle. So you can see the pupil get constricted. The both pupils are getting constricted. Here the direct light reflex, and here the consensual light reflex. Hope you clear that. I will show you the accommodation light reflex from this diagram. Actually, this is not a very good diagram to show you the accommodation reflex, but I will explain about the pathway. The accommodation reflex means the eye focus from a distant site near object, medial rectus muscle contracts, and there may be convergence of ocular axis. So the contraction of ciliary muscles causes thickening of the lens and increased refractive power, and contraction of the constrictor pupillae muscle causes pupils to get constrict and restrict light to central part of the lens. That is the accommodation reflex. So the pathway is, imagine this is the light source coming from the distant object. From the distant to nearer object. Then this light wave goes directly towards the visual cortex via this pathway. And then what happens is, from the visual cortex, imagine this area is the visual cortex. From the visual cortex, the fibers coming towards the frontal eye field. This is the frontal eye field. The fibers coming to the frontal eye field. Then from the frontal eye field, there are cortical fibers origin, and cortical fibers goes towards the Meninges nucleus of the both side. These are the Meninges nucleus of the oculomotor nerve. So the fibers going to the Meninges nucleus from the frontal eye field. This is the frontal eye field. So, from the Meninges nucleus, the fibers are coming to the ciliary ganglion from this pathway. Then from the ciliary ganglion, it gives to the constrictor pupillae muscle and also ciliary muscle. Then another type of fibers going from the internal capsule to the nucleus of the third cranial nerve, and then directly fibers are going to the medial rectus muscle. Medial rectus muscle. So when the impulses are going to the medial rectus muscle via the oculomotor nuclei of both sides, then convergence of ocular axis can be seen. Next type of reflex is the corneal reflex. First, you have to touch gently the cornea by using gauze or cotton. Once you touch the cornea, the sensory impulses are coming from the trigeminal nerve to the sensory trigeminal nucleus in the spinal cord, or here the sensory nucleus, and from the sensory nucleus the fibers going to the facial nerve nucleus, the motor nucleus. Then from the motor nucleus the fibers going to the orbicularis oculi muscle. As response from the orbicularis oculi muscle, the eyes get closed. That is the corneal reflex. Hope you are clear with these corneal reflexes. Now I'm going to discuss a little bit about how the optic nerve is tested. So the visual acuity of the optic nerve, the distance vision is tested via Snellen's chart. The near vision via Jagger's chart. Visual field testing is done by confrontation method. That means comparing the patient's vision with doctor's vision or perimetry. Then the pupils and eyelids are checked by direct and consensual light reflexes. Then the color vision is checked by the Ishihara's chart. Then you have to check the optic disc and fundus using ophthalmoscope or the funduscope. Here, when you looking at the ophthalmoscope, you have to check the blood vessels, the four arteries, then the retinal color, the pinkish red color, then the slight darker red color, the macula, as well as the optic disc, which is creamy pink, margin is clear and center is pale and hollowed out. That is the optic disc. So you have to concentrate on those aspects while you are examining using ophthalmoscope or funduscope. So that's all for the optic nerve and the visual pathway. I hope you guys are clear about the visual fields and the optic nerve pathway and what happens when the visual pathway when there are lesions in the visual pathway, what happens to our visual fields. So many aspects I taught you in this video. So if you like this video, please put a like and a comment as a feedback to my video, and please subscribe into my channel for more videos. Thank you for watching.